So welcome, everybody. So excited to see you all this wonderful day. My name is Elena Olson, and I am the Executive Director of the Center for Diversity and Inclusion. And we want to welcome you to this wonderful panel discussion on matching into top U.S. residencies as an IMG, International Medical Graduate. It's an info session. And we're really delighted that so many of you could join us this afternoon. This webinar is sponsored by the Mass General Postdoc Association in collaboration with the Center for Faculty Development Post-Doctoral Division and the Mass General Center for Diversity and Inclusion, which I am the Executive Director of. The panel discussion is the result of an initiative the Mass General Postdoc Association requested from CDI to partner with, to have, given the large number of IMGs that we are seeing throughout the country actually interested in matching in residency spots. We are super happy, really happy to support their desire to provide help and resources to the IMG community in applying to residency. And this is really in line with our MGH Structural Equity Plan and the MGB United Against Racism campaign initiative that is supporting the expansion of CDI, our Center for Diversity and Inclusion, to reach and work within the research community, which of course includes our IMG postdocs and many, many others in the research community. We have a couple of housekeeping items today, and while we have asked our attendees to share questions, many of you have submitted questions, and our panel moderator, Joelle Hokayem, will actually be asking those questions. We would like to make sure that that if you have any questions, that you might also post them in the chat here, and we will limit the questions towards the end of the panel because of time constraints. So those are some of the housekeeping matters. So at this point, without further delay, it's my extreme pleasure and honor to introduce to you our moderator, Joelle Hokayem. Dr. Hokayem is a postdoctoral research fellow here at Mass General. Her research focuses on establishing a new drug compound to treat aggressive brain cancer. She currently serves as the chair for Diversity, Equity, and Inclusion at the MGPA, the Mass General Postdoc Association. And she's also served as a TEDx MGH speaker for the Postdoc Appreciation Week. She is herself an IMG, and I really want to have all of us welcome her to the Zoom stage. So Joelle.
Thank you, Elena, and thank you all for joining today's panel discussion on tips for matching in top US residencies as an international medical graduate, which will be referred to as IMG throughout this panel. Being an IMG myself, it is my pleasure to moderate today's panel discussion regarding a topic that is close to my heart and others at Mass General Hospital and within the Mass General Postdoc Association. We hope that the information shared over the next 45 minutes will help as you consider and apply for residencies in the US. I am honored indeed to introduce our panelists to you. Dr. J. Vyas is the Program Director of the Internal Medicine Residency Program at Mass General and an associate professor in medicine at Harvard Medical School. Dr. Vyas is an immunologist and infectious disease specialist focusing on basic investigations of host pathogen interactions. He currently supervises about 212 interns and residents. Dr. Robert Hasserjian is the director of Hematopathology Fellowship Program and the associate program director responsible for resident recruitment in the pathology service here at Mass General. He is a professor of pathology at Harvard Medical School. Dr. Hasserjian's clinical work and research focus is on myeloid neoplasia. He is currently the vice president of the Society for Hematopathology. Dr. Richard Bido-Medina is a PGY3 psychiatry resident and member of the Physician Scientist Training Program at MGH, and is the Education and Career Development Officer for the Center for Diversity and Inclusion Resident and Fellow Committee. He is also a Fulbright Fellowship recipient. Dr. Elie is an incoming clinical fellow in plastic and reconstructive surgery at Mass General Brigham and Harvard Medical School, and the chief resident in general surgery at Oregon Health and Science University. We are indeed very grateful to have our panelists here with us to share their experience and provide helpful tips on matching into top US residencies as an IMG. So first, allow me please to start with some solid data that could portray the position of IMGs today, and in particular, IMG trainees in Mass General Hospital, one of the two main hospitals that are IMGs friendly in Mass General are Mass General Hospital and Mass General Brigham. And we can see that IMGs comprise 5.7% of trainees in Mass General Brigham and 3.8% of the Mass General Hospital itself. Moving to the next slide, I would like to portray the importance of IMG percent of the applicants as a whole. So if we were to make some simple math and sum up the US IMGs and the non-US IMGs, which would account for 12,074, and divide this number over the total active applicants, we can see that IMGs, in fact, comprise more than 30% of active applicants when it comes to the 2020 main residency match. I would like to mention that all the graphs in this panel discussion will be extracted from the NRMP, which is the National Resident Matching Program, a nonprofit organization established at the request of medical students to provide a fair process for matching preference of US residency applicants with those of the residency programs. So going to the next slide, we can see that if we were to see the trend over the years, we can see that actually the trend is going upward and has increased by 50% over the last decade. So from 2011 to 2021. Now for the matching percent of both US and non-US IMGs, it has also been on the increase over the last decade. So let us have a look over the matching stratified by specialty in 2021. So in the slides, the next slide, Karen, if you allow, yeah. So here, if we were to sum up the total of the PGY1 as well as the PGY2 residents, we can see that, in fact, the matched IMGs per se comprise 22% of these filled positions. So we saw the number of applicants percentage. We are now seeing the number of matched applicants in the last decade. Before moving to the main evaluation measures that programs consider in the matching process, let us learn about networking, which is indeed an integral part and gateway to the residency and matching process with Dr. Ramli. Dr. Ramli, as an IMG with no prior hospital connections, how would you go about building a solid network, especially in a non-IMG friendly specialty? If you could tell us a little about the letter of interest and the letters of recommendations that you had to go through.
Thank you, Joelle, and thanks everyone for having me. I think I would divide my answer along three themes, because you mentioned networking as well, and I think they all go hand in hand. So first of all, I think it's a mindset shift. So if you're an IMG, and that goes for anybody coming from any circumstance, first of all, stop thinking of yourself as an IMG. The only thing you need to take out of the fact that you're an IMG is that look at the statistics, observe the setting you're in, and try to define what are the gaps that you need to bridge. Are there gaps in certain skills, in certain experiences, and then focus on these. And second of all, understand and plan on evolving from the fact that being an IMG may be, a setback, or maybe viewed as a setback by others or yourself, to eventually end up in a situation where being an IMG is actually enriching the program you're joining, and you're bringing something else to the table. And with clarity and focus, you can get there. So that's first of all. Second of all, put yourself in circumstances and around people that will actually help you evolve to the next level. And that means, take up a postdoc fellowship position, volunteer, anything that gets you in a situation where you will be able to learn from different people, engage with a different community, and improve. And then third of all, you got to get engaged. So even if you put yourself in these situations, you really have to be very proactive about reaching out to people, about signing up for projects, about finishing projects you're on. And there's a lot, these are like general points, but I'm very happy to go into specific details later if we have time with the questions, or if you want to reach out offline, that's totally fine as well. With regards to letters of interest, I think one of the big problems that I see is usually people, they either send very long letters, They pack the letters with information they potentially think is very useful, but the program or the program director may not. For example, a lot of personal details about, the fact that they're an IMG or where they come from, or what they would like to achieve and so on. And I think the key here is put yourself in the shoes of the person reading this. They have 1,000 emails. They have a limited amount of time to read your email, and they are looking for something different. They're looking for somebody who's going to be a team member, who's coming in, who's going to be able to add to the team, and that they would want to work with. So focus your email on being brief, having a one-liner about what you stand for, what you're interested in, and what you hope to bring to the table. Feel free to highlight a research topic or area that you've had experience with or that you're very interested in, and provide the name of a reference or a PI or somebody you worked with, so that people can reach out to them and have a firsthand feedback on what it is to work with you as a person. You need to transition from being a name on a piece of paper to somebody that can be an active human team member and that people can relate to or have some references about. And then with letter of intent, I think the big key here is having a story. So you don't want your letter of intent to be a regurgitation of your CV. You really want to focus on, and that's the same for when you network at conferences or when you speak at an interview, people are going to say, invariably the questions are going to come up as, okay, tell me about yourself, or why do you want to do what you say you want to do, and so on. And you need to have a 90-second pitch, or an elevator pitch, and write it down, rehearse it, think about it. It needs to just be the essence of why you want to do a certain specialty, and just be very genuine. But practice saying that concisely in 90 seconds. And your letter of intent, that's an expansion of that into a meaningful story that's compelling enough for somebody to be like, okay, I get this. This person is coming from the right place. They have their mind and heart in the right place. And this is somebody that I would actually want to know more about, or that I would want to at least interview or work with eventually. So that would be my advice.
Concise and genuine. Thank you so much, Dr. Elie, for your input. So going back to the panel info session, I cannot see the PowerPoint, but I can go on. So based on what measures would IMGs match in a given residency program, which we can see the table in the next slide. Okay, so here we can see that mainly there are 10 measures, but there are mainly 3 main aspects that seem to be beneficial when it comes to IMGs who have matched compared to those who haven't. So if we were to consider US IMGs and non-US IMGs as one entity under the IMG, if we were to compare the match versus the unmatched, we see that the main 3 components are: 1, mean number of contiguous ranks; 2, the USMLE board step 1 and step 2 score; 3, it would be the mean number of volunteer experiences. Surprisingly, I know many of you are raising some question marks regarding the other 7 measures that are on this graph, but we will go back to them throughout the panels. So if we were to see the very first slide, when it comes to the mean number of contiguous ranks. So let me first address this measure. So when it comes to the mean number of contiguous ranks, after the interviewing season takes place, let us say an applicant had 50 interviews, and then he has ranked 20 out of them, based on their preference of the hospital program or the specialty itself. If you can go to the next slide, Karen, if you don't mind. So there is no way an applicant is going to match into more than 20 because he only applied to 20, which is why the NRMP states clearly, in general, applicants are more likely to be successful if they rank more programs in their desired specialty. IMGs who matched to their preferred specialty had median contiguous rank lists that were no longer than those of US IMGs who did not match. So going also to the next slide. So IMGs who have, going briefly over the next measure, we see that the volunteer experience, which seems to have a powerful impact, is most pronounced in certain specialties more than others. Now, addressing the application process itself, another main measure that we saw other than these 2 is the USMLE scores, which is more of the nightmare and the dream of the UMGs, of the IMGs, if you want. So we can see that in the USMLE step 1, going to the next slide, that on average, the USMLE score for step 1 for US IMGs who matched is around 222.9 for US IMGs and 233.9 for non-US IMGs, both of which are well above the 2020 minimum passing score of 194. Now, as for step 2 CK, which is a measure of an applicant's ability to apply the medical knowledge, skills, and understanding of clinical science essential for providing patient care, the score would be 233 for US IMGs and 240 for non-US IMGs, which is also in this case well above the minimum passing score of 209. So to know more about this, I would like to address the question to Dr. Hasserjian. Dr. Hasserjian, in view of your position when recruiting residents into your program, how important is it for an applicant to have great scores on the board? Is it possible, however, to match into a residency program with a low step score?
Yeah, thank you for that question. Yeah, I think regarding the step scores, I think there's, good news and bad news in a way. So the good news is that we do look, or I look at the whole application. So I don't think there's no step score. I know some places do use screening and, people won't even look at the application if it's below a certain amount. We don't do that. We look at every single one. So I think even if the score is low, if it's passing, I think it's still okay. The application won't be necessarily discarded. It'll be looked at as a whole picture. However, that being said, we have studied this and we do find that the higher the step score, step 1 and step 2, the better people perform in residency. So, and this is not just a legend, this is something I've studied in our program, and it is backed by evidence over the past 10 years. So we do take that into account as an important factor. So an applicant having a much higher step score, I think I'm more likely to see as a favorable thing and more likely to grant an interview than someone who has a much lower score. Someone who has a lower score could still be given an interview if they have a lot of other positive factors, which I will have a chance to address, I think, in a later question. So I think it is possible to match, at least in our residency, and hopefully most programs that will look at the whole picture rather than just the USMLE, but certainly getting a very good USMLE score is an important thing. So you should try to do well on the exam, both step 1 and step 2. I think that is important. And I think also a very high score is a positive thing. I think it's not just not having a low score, but also a score that's much higher, say 250, 260. I mean, those certainly mean that the person has a very strong medical knowledge. And again, those do correlate with very high performing residents in our program. So I think that is also a plus that could be in an application for someone that does very well.
Absolutely. We know that years down the line years back until today, the step 1 score has been one of the main selection criteria that programs would evaluate IMGs for. They would even use it as a filtering whether to accept the candidate or not. But how does the change from a numerical score into pass or fail in step 1 influence the IMG matching amid the changes that are to be implemented in January 2022? Will the focus be rather on step 2 score, US clinical experience, or actually the medical school ranking or transcript?
Yeah, that's a very good question. That's something I think we've all struggled with, is it does become pass-fail, so you can no longer use the step 1 score, which despite the fact that at least in our program, it seems to correlate, be a very helpful marker in terms of determining residents that are likely to do well in our program. So I think what we'll do is use the steps 2 score probably a little more, and I think almost all IMGs will have the step 2 score available, but I'll also look at other things too. I think, again, the step score, it's not just, it seems really cruel. It's not just that we're grabbing a number. We are looking at it as a kind of a marker of the person's medical knowledge, and they're coming into the program with a good basis where they'll be able to learn our specialty more efficiently. So I think we'd look for other surrogates of that, which could be, for example, medical school grades. So I think having a good performance in medical school is also important. That is, in the preclinical and in pathology, we do focus on even preclinical courses, perhaps more than other specialties, but also in the core clerkships. And I know we do look carefully at transcripts from international medical schools, and we do look at those differently because in the U.S. medical schools, let's be frank, in the dean's side, there is a lot of inflation.
Absolutely,
so you look very carefully. And we do know that many medical schools from other countries don't do that. And it's, and so I think we're aware of that. And so I think we do look at the applications fairly, but certainly performing very well in medical school. If that reflects in the dean's letter, I think can be a good substitute, and we still do use that, even knowing the step 1 score, in terms of showing an applicant's sort of academic potential and medical knowledge that will be important in terms of them succeeding in our residency. I think in terms of US clinical experience, I can talk about that a little bit later, and research experience, those are, I think, different sort of metrics that are kind of a different axis, if you will. But when I'm talking about the step scores and the medical school transcript, that's just looking at the person's maybe academic sort of potential and background and being competent to perform well in the residency.
Mm-hmm. That's totally understandable, but would you, however, have any suggestions for applicants with a low rank in their medical school transcript, however, a good step 2 and a solid US research experience? Let's put it
so
way.
That's a good question. So many applications are sort of, as I say, a mixed bag, right? I mean, you have some applications where everything is strong. They have outstanding step 1 and step 2 scores. They have top 5% of their class in the dean's letter, have publications. That's great. But sometimes there are mixtures. And I think we, again, do look at the whole picture. I think in terms of if someone has a good step 2 score, but may had a lower rank in their medical school, I would try to give the benefit of the doubt and say, well, why didn't they do as well? Maybe it's a medical school that does it, that grades more harshly. Perhaps they didn't do as well in specialties, in clerkships that may not impact their performance in our residency as much. So I think there still is hope again. I think if someone scores low USMLE and has done not so well in medical school, I think that is definitely more of a problem. But if someone has good in one of those, I think that is I think can still be a very positive thing, and that is something that can be emphasized also in the personal statement. I know that Dr. Medina will be talking about as well, but I'll just say briefly, I think one thing you do want to do, and I completely agree with what Elie had said about trying to make your letters concise, but the same thing with a personal statement, and emphasize your positive things, like emphasize if you did really well in medical school, try to bring that out. And if there is say you didn't do well in US step 1 because it was a bad day, or there was something happened, some mitigating circumstance, that is something you can mention in a personal statement so that the person reading can understand that, maybe realize, won't use that necessarily against the application if there's an excuse. So I think if there is a sort of a weaker aspect of the application, you address it head on and explain it in a personal statement. I think that can help in mitigating the effect of that in, decreasing the chance of an interview.
Mm-hmm. Thank you so much, Dr. Hasserjian, for your input. So to continue addressing topics with regards to the application itself, apart from the USMLE score, Dr. Bido-Medina, how can IMG applicants make both the personal statement and resume, DEI, as in diversity, equity, and inclusion, and IMG, International Medical Graduates, friendly to stand out?
Thank you so much. This is a question that I actually love. I think my favorite part of the application is the personal statement. And I do believe that most of the application is templated, and the personal statement is actually the part that you can kind of be more flexible and kind of put your own flavor, like I used to say. So yeah, the reason why it's my favorite part is because the personal statement is, to me, the element that actually glues all the application together. It's what makes it cohesive and makes it, that it has complete sense to the person who is reading to get to know you, even if it is by written. So make sure that it is congruency with the rest of your application, but also be mindful that it is not a CV. Because even when you have the opportunity of reviewing applications, which I have been involved in the recruitment process, you can see that sometimes the personal statement seems more like a summary of your CV, and that is not appropriate. Why? Because the personal statement is the place where you want to show your passion about the field, and you want to emphasize those positive things, like Dr. Hasserjian mentioned, those positive things that you want the person who is potentially going to interview you to know you and to get to know about you after that. So that is the part where you can be yourself and let the program know in written who you are. While the rest of the application, again, is like a templated CV-like format, the personal statement gives you the freedom to shine in written by showing your passion about the field, whatever it is. Make sure you address any red flags, like Dr. Hasserjian mentioned. I think it's really important. And particularly, I don't like using the name red flags, because sometimes what I perceive as red flags is probably just a disadvantage, just because you come from a different background. And it is common, for example, IMGs. I do remember I'm from the Dominican Republic, And we didn't have any like research program or PhD programs, and like that is something important in the US. Even if it's like clinical research, basic research, that's an important thing that you should put on your CV or your personal statement. And you just have the disadvantage because it's not a common thing in your country, and then you just come with that red flag that is not really a red flag. It's just something that you miss, but you are probably really talented to do. So show your passion about those things, and just mention if you did not really well in one particular course, just like make sure you address that, because they probably gonna ask you. And if you're upfront with that, I think that tells that you're really aware of the person you are in your position as an applicant. I think you can give yourself the opportunity of being a human being. Sometimes it's important to be vulnerable. And I mean, I might be biased because I come from psychiatry, but I do feel that you have to put your personal flavor and appeal to the pathos. Sometimes it's important to appeal to the human being who is reading the statement in the other side. When reviewing your personal statement, you need to try to like catch the reader's attention in your first paragraph. And like Dr. Ramli mentioned, think of yourself as a positive addition to the program. You have a lot of value. We're probably an independent person in your home country. Maybe you were practicing for a while. Maybe you bring a different perspective to the program, and you can emphasize that in the personal statement. And just some tips before submitting. If writing to specific programs, make sure that you don't submit the wrong statement to the other program, because that could happen. You're a human being sending lots of applications, so you can miss something and sadly send a different statement to a different program. So make sure you upload the most updated version. Don't leave it for the last minute. Review with fresh eyes. Always important just to proofread and check for the grammar stuff. Review it as many times as you can. Have someone review it, but someone that is familiar with the process of the application to residency, because it's not just like a simple essay. It's your personal statement for residency application. And try to avoid cliches, things that are commonly used that you would find like online, some templates. Try to be yourself and be prepared. In terms of your personal statement and CV, especially in the CV, make sure that sometimes people make the CV bulkier just to make sure like it's bulk and mention a lot of things that are not necessarily relevant for your field or for the application process. And those things can haunt you. Like they can come back to you, and the day of the interview, they're gonna ask you about these things. And if you put a lot of things that you can probably not remember, then you're gonna struggle trying to like portray that in the interview, like show those things. So yeah, just put your own flavor, give yourself your chance to be yourself, and think of yourself as an added value to the residency.
So I would actually like to echo what you said, and Dr. Ramli, regarding how you should actually consider yourself as an addition. As an IMG, you should actually approach the program with confidence and self-esteem that is actually portrayed by your hard work, rather than maybe the unfortunate opportunities that you may have had in your underserved background or so. So regarding this, I would like to continue addressing the fact that most IMG postdocs present in this meeting from the Mass General Postdoc Association are currently running many research projects. Dr. Vyas, in view of your experience, what are the pros and cons of having postdoc research experience when applying for residency programs?
Well, thanks, Joelle, and thanks to the organizers for asking me to be here. It is really a delight to address this group. I will get to that question. I just wanted to endorse what has already been said from Elie, from Robert, and from Richard. There's many things here that and including your slides, which I think are particularly foundational and very important. A couple things I just wanted to emphasize from those things. Applying to a wide variety of programs, I think, is incredibly important. And as you think about it, as you think about the programs that you can see yourself working in, keeping that list of ranked programs as long as you can, I think, is a very reasonable one. I tell both IMGs as well as US medical graduates to don't fall in love with a single program, because I think falling in love with a single program and saying that's the one program that I'm going to go to and then everything else would be considered like a place that I can't go to makes it for a very difficult match process. And so I think that there's, if one steps back and looks at it realistically, there's probably a number of different places that people can find happiness in those areas. And I would also say that I think many many of the people in the audience may be thinking about different areas within medicine. And so I just want to maybe acknowledge that some things that are maybe more relevant in, let's say, internal medicine, may be less relevant in some of the surgical fields or in pathology or pediatrics. So there is nuance between all of those areas in terms of what you thought, in terms of all of these disciplines and where some of the, what the emphasis might be in some of those areas. So on to research. So you're right. Many of the folks who are here within the MGPA are here doing research. And I think that and generally, I think that there are a number of pros to do that. Number one is that it gives you exposure to how clinical research is being done. And as Richard mentioned, maybe that may not be something that you've been exposed to prior to that. And so having the opportunity to at least learn that process and understand how questions are asked and how those questions are answered in the medical research area becomes an incredibly important, valuable, whether you end up doing a research-based career or not. And so then the second part of that is access. You're now in an environment where you're doing research in a hospital, or you're doing it at a medical school that's adjacent to the hospital. So see if there are opportunities that will allow you to be exposed to those clinicians, and see if those clinicians may be able to provide you with some opportunities to be able to go and see patients. Prior to COVID, that was actually a particularly easy thing or easier thing to do. In the setting of COVID, that has become much more difficult, not only here, but in many other institutions. The access to patients, access to clinical rotations has become much more difficult as a relate of capacity. Most hospitals run with a fairly tight capacity and their footprint is relatively small. So the workroom can only accommodate a certain number of people. So it's not that we're trying to exclude a lot of individuals. We just simply don't have this physical space. We don't actually have the square footage to include a number of additional people onto our teams as it relates to that. But if you're here, you're working, your PI or your collaborator is someone who goes and sees patients in the clinic, maybe perhaps that's an opportunity as you continue to do your research, you might see this as a great opportunity for you can actually go in and see that. And having the opportunity to see what that's like and how we take care of patients in a U.S. medical-based system, it oftentimes gives you a great opportunity now to talk about what are the differences. So, in that personal statement that Richard was talking about, you might have a very unique perspective now on how you compare and contrast. What are the ways that people approach patient care? What are some of the cons in terms of doing research? Well, if you see people who are doing research and they've enjoyed research, or they've been doing it for a couple of years, and there may be a variety of reasons why they may be doing it for a couple of years, people are going to pick up the application and they're going to try to figure out, is this someone who's really interested in a research-based career after they finish my residency, or do they really want to do clinical practice? So within the area of internal medicine, you can largely divide internal medicine residencies into those that are research focused and those that are provide kind of community-based practice. And so for the community-based practice ones, which there are a number of incredible good ones, not only here in Boston, but throughout the country, they will, when they see somebody who's doing a fair amount of research, they may say, well, we may be not a great match for this person simply because this person really wants to do research and we don't have a research infrastructure at our hospital. But then maybe you were doing research for 3 years because that's what you needed to maybe gain the optimum experience. Maybe it was important for you because of other family reasons that you needed to work for a couple of years before you could actually apply. So again, as you've heard before, using the personal statement to give you a sense of where you've been and where you're going, that second part being quite important, is really important. So if you're really interested in doing research and want to do research and you're going to apply to research intensive programs, then having those years of research are going to be a big plus, but they can be a liability if your goal is really to be there taking care of patients in the community and serving those patients in that area. And those programs may misunderstand your years of research as something where you may not be considered particularly strong. The longer you also do research, the more you've oftentimes not been in terms of seeing clinical patients, and so that gap can also be considerably a potential concern.
Yeah. We're going to be talking about this gap in a minute, but before that, I would also like to address the importance of networking that Dr. Ramli has tackled, because, when you are looking for a US clinical experience or research experience and you're coming from an underrepresented background, you won't have as much opportunities. And this is where the networking importance pops in, because they would tell you the known vicious cycle. You have no research experience and then you're applying, just like when you're applying as a fresh grad to any position. So I will gladly go back to the slides on the PowerPoint and now have a look at the research measure in the table in the next 2 slides. Okay, so can you go back, go forward 2 slides, please, Karen, when it comes to the table that has the different 10 measures.
For some reason, I'm not able to move the slides backwards or forward.
Oh.
I'm hitting the thing, but the slides aren't moving. Oh, here we go. Am I going in the right direction?
Forward. I think you went backwards, but I can start.
Tell me when to stop.
Yeah, go forwards. It's 2 slides ahead. Okay, so I'm gonna just start with this current slide. So IMG is matching based on 10 measures. We already spoke about the contiguous ranks, the USMLE step scores, and the number of volunteer experience. Surprisingly, just like I said, and Dr. Vyas has just addressed the point of research experience when it comes to IMGs. So surprisingly, we don't see research experience in here as being more of a helpful criterion. Why is that? And would we say these results are actually statistically significant or not? So going to the next slide, we can see that. Go ahead, like if you can please to the next slide.
Yep, I'm hitting the button. It's just not going. It may be that my computer is very slow.
So we can see here that those who have matched seem to have less research experience than those who have not, which would raise obviously a question mark. The possible causes could be that, as per the NRMP, in most specialties, matched US IMGs had fewer research experience. And I know many of you are questioning their current position and everything, but matched non-US IMGs had more research experience than their unmatched counterparts in competitive specialties such as orthopedic surgery, dermatology, general surgery, and neurologic surgery. So going on to the next slide, we can also see that when it comes to publications and abstracts, in the next slide.
Yep, it's just, I'm hitting down, but it's just not moving.
It's okay, I just keep talking. So I'll just address it. So when it comes to the number of publications, the residency programs usually divide publication into 3 different categories. 0 publications, having 1 to 5 publications, or more than 5 publications. So there is a large number of publications that is mainly found in surgical specialties, such as the ones that I've previously mentioned. However, the sample sizes for those specialties are generally small for IMGs. And in those specialties, matched IMGs generally had more publications than IMGs who did not match in their preferred specialty. So speaking of surgical specialties, I know many attendees were asked to have addressed mandatory questions to the panelists prior to registration, and many of them were interested in knowing how to match into a surgical specialty. We know the surgical specialty is more competitive, and I would like to address the question to Dr. Ramli, who is currently a plastic surgeon in reconstructive surgery. Could you tell us a bit more about the role of research or maybe any other contributing factor that has helped in your matching experience?
So thanks for the question. Just a clarification, I'm not a plastic surgeon yet. I am finishing my general surgery residency and then doing a plastic surgery fellowship. So there's 2 ways to go into plastic surgery. You can do an integrated program or independent. I'm doing the independent track. And I say that to also say that there's no one way to go about anything. So the way I will use surgery as an example, but I think that a lot of these things apply to any specialty. People in a certain specialty want to see some form of dedication to that specialty and are not necessarily interested in an applicant who cannot necessarily demonstrate a track record of involvement and dedication to that specialty, or something that would really mean that they've thought about this choice, and that they would not be somebody who would say, leave the program or change their decisions, a year or 2 into it, or that somebody who at least knows what they're getting themselves into. And that's actually very healthy on the applicant's side of things. So there are a lot of ways to get involved with the specialty. One great way is research. I totally support doing some form of research, whether you do that during your training or before your training or in the middle. I actually did a research fellowship between medical school and a residency, and I then stopped in residency when I was doing general surgery and did a research fellowship specifically in plastic surgery because I identified this as an area of interest and wanted to really dive deeper. And I encourage that as well. For IMG applicants, I think doing research between your transition from your country to the US is so valuable. And I think that echoes what Dr. Vyas was saying, which I totally agree with, because you will be immersed into the environment. You'll get to interact with people. You'll get to go to grand rounds. You'll get to maybe shadow somebody. You'll get to see how people communicate and work together in teams, what the expectations in the workplace are, what the norms are, what the cultural nuances are. And I think that's super important. Whether you have direct access to patients or not, ideally you want to, and you can supplement your research experience with some of that, whether you're, say, consenting people for a trial, going to clinic to do things that are related, asking to shadow or to see somebody in the operating room, and so on. But either way, doing the research and doing it in the specialty of your choice would be ideal. In research, it's so important to be productive. If you're doing 2-3 years of research but have very little or nothing to show for it, then you really got to question, the interviewer will question what you were doing there. And the way to be productive is to be very strategic. It's great to have 15 projects, but if 14 of those projects you're waiting on an IRB, or you're collecting data that takes 5 years to complete, or you're working on a multi-center study where you may not be on the publication, and that may take 10 more years to publish, then you're really not gonna be able to show much fruits from your labor at the end. So you want some of these projects because it's a great experience, and it's one way to help out the team you're with, and that's partly why you're hired. But also you wanna, even if it's on your own time, like even if you're working on a weekend, you want to figure out ways to write projects that you can finish. You want to analyze data that's already collected. You want to, or from a database. You want to come up with your own research questions. You want to analyze and then write up the data. You want to write paper, write a review, write a book chapter, anything. And the way you get better as researchers is like anything else. Just do more of it. If you finish a manuscript, the next manuscript is going to be much easier. And work in teams. You don't have to do everything about the manuscript. You may have a few projects that are like your babies where you really want to do everything and write the manuscript from top to finish. But otherwise, if you find a team that is synergistic and everybody can help each other out, that would be the ideal route. Specifically, because you asked about surgery. I think obviously the things we talked about, specialties, about, dedication to a specialty. In surgery specifically, people will want to see away rotations, ideally in the subspecialty you're interested in, but not necessarily. And they will want letters of recommendations from surgeons, ideally from surgeons who have worked with you in a clinical setting. It's good to have one letter or maybe 2 letters from your research mentors, but you need to have letters from people who have seen you in a clinical setting. Ideally, if you're coming from a different country, have 1 letter from that country, ideally from the chairman of surgery or a chief of division. And a little point here is it's much better to have a letter from somebody who doesn't have a title of a chairperson or a chief, but that knows you very well and can give specific examples and stories about their interactions with you and specific personal traits. That's much better than a letter coming from a chairperson who barely knows you. And that'll show, like a letter that is generic, that's a template, will show right away, or that's not very enthusiastic in tone. But you want letters from surgeons, and you want letters from surgeons, 1 letter from your country, but you want letters from surgeons in the US who have worked with you either directly and on a rotation or that have interacted with you in some substantial way. And then, so away rotations, letters of recommendations, publications at your level. If you're applying right now for residency, I know, we all want to publish in the New England Journal of Medicine, Lancet, Nature, and whatnot, but don't just get hung up on that and get blocked. Again, you will get there, but the way to get there is to get better as a researcher. And to get better as a researcher is to publish. So at this level, people want to see numbers because that says one thing. It says you're a finisher. You will finish what you start.
Yeah.
You get things done. You can work people know what it takes to publish and how tough it is. And seeing publications on your CV mean, and especially first and second author and so on, means that like you have been able to work with a team, you've been able to formulate ideas, you've been able to communicate and follow up on things and write and publish and do the reviews to the response to the reviewers. So that's the other thing. And then the last part, I think, is if you can have some volunteering experience, that would be a positive.
Absolutely.
For example, in some surgical subspecialties, that's very important. If you can do some, say, missions, in my case, I was volunteering with cleft lip and palate outreach initiatives. And that was a great thing to talk about in my personal, and it's something that I wanted to do, but that's a great personal angle you can add. And it's again, something that reinforces your love for the specialty. And the last thing I'll say, that's a little bit less traditional, but the world has changed a lot, and especially post-COVID, it's tougher to get in-person experiences and so on, but there's a lot you can do. You can engage on social media with the programs, go to their info sessions. You can, and that goes both ways. You'll get to know much more about those programs. Twitter has just added a function where people can have live discussions that are just audio-based. On Instagram, people go live and talk about their programs, talk about different things. I'll give an example about my specialty, like plastic and reconstructive surgery. The Journal of Plastic and Reconstructive Surgery is very active on social media. And what that does, they have journal clubs where you can log in and ask questions, interact with the authors. And now you're again growing your network and you're getting to learn more about it. Like when the time comes for you to interview, you'll have a much deeper understanding of the specialty. You'll be able to answer questions in a much more thoughtful way, and then and define what you want out of that experience. And you can peer review if you're on research. Get yourself to peer review for journals, whether you get credit for it or not, by helping your mentor, by drafting something that they can then review. Either way, it's gained experience, and those would be, and then obviously and that's key, especially in competitive specialties. Go to meetings, even if you present, that's ideal. If you're not, that's still fine. Go to the American Society of, say, Plastic Surgeons, or the American College of Surgeons, or any specialty meeting. Interact with people, go to their talks, talk to them, learn more, and being there in person helps a lot. So there's a lot of things you can do online and offline, but the key is to be engaged and to deliver results.
Thank you so much. I just need your brief assertive confirmation as we're running out of time. So as you have mentioned, the letters of recommendation and having the surgical experience. So would you say it's very important to have letters of recommendation, even if it's not related to the surgical specialty that you're applying to, correct?
If you have, if you're allowed to have, say, 4 letters and 3 of them are non-surgical, that's obviously not ideal.
No, I mean like surgical, but not the surgical specialty that you're applying to, or maybe your research experience is not surgical, but you're still applying to a surgical specialty and you're getting like letters of recommendation from surgeons.
I think, especially if you can weave it into your story, like why is it that you did pathology research and you're applying for surgery? If you would have to explain that. If you can explain it in a meaningful way, and the letter that from your mentor there, says meaningful things about you as a person, that's totally fine. And within surgical specialty, as long as it's surgical, I think it's good. You do want at least 1 letter from the subspecialty you're interested in, because that will, I think you do need that, but it's not a game, a deal breaker. You can still do fine, but you want to have surgical letters at least. And the last thing I was going to say is, I actually completely forgot, but it's related to that.
You gave us more than expected and more than they want, more than all the attendees are grateful for. So anyways, as we're, thank you so much for your input, Dr. Ramli. So I'm gonna jump into, many attendees have also asked prior whether having a PhD is also one of the 10 measures that's seen earlier as being beneficial or not. Now, is it perceived as a research experience, a chance to have more publications, or rather as an undesirable gap from the patient encounter, being far from the clinical world? Please give us your input, Dr. Vyas.
So I think if you're really interested in doing a research career, then a PhD makes sense. If you're doing that because you think that that's going to give you a collection of research experiences that will eventually get you into a clinical residency, I think that investment is oftentimes too high. The key part there is what was your last clinical experience and when are you applying? The longer that gap is, the more people are going to worry how good are your clinical skills coming from there, because someone has assessed you here, but now there's a lot of time that's passed. And so now they want to know if there's a whole PhD in there, are you still this good over here?
Would you say there is a maximum number? Like I can address this question to Dr. Bido-Medina. Would you say there is a maximum number between the year of graduation and residency to have better chances of matching? Because I know, Dr. Medina, from your personal experience, you also had your PhD degree earned before applying to your psychiatry residency.
Yeah,
so could you tell us more?
Exactly. So I went to med school in the Dominican Republic. We didn't have, I was really interested in pursuing a research career. So I had to like apply to a PhD in the United States. And I was so lucky that I got the Fulbright fellowship. I came to the US, got my PhD in neuroscience, and then applied to residency. I think for what you can see online, and average people prefer people who are not older than 3 or 4 years from graduation. And I think there are three main assumptions for that. First, you're going to be rejoining a learning process. Second, you're going to be away from clinical work, like Dr. Vyas said. And also, there's like this process of adjustment to a new system, because you're an IMG, so you need to get familiar to the US clinical system, which is different. And like I can confirm that the 3 things are actually real. I graduated in 2012. And I applied to residency in 2018. So there was a gap there. I was lucky that during my PhD, because it was a lot of clinical work too, I was kind of like involved in the clinical system, and I was like doing my own clinical interviews for the patients I was recruiting for my translational projects. So that kind of show up. So that's the important part, I think. If you're applying, like Dr. Vyas said, if you are willing to pursue a career in research or combine clinical research, it makes sense. If not, I think it's not a good investment of your time, particularly because it can harm the opportunities to match into a residency. But yeah, I think you should be mindful of those things. And obviously, if the residency you want to apply, in my case, my PhD was in neuroscience, and my research aligned very well with the goals of my residency training, which is in psychiatry, right? But if you're like pursuing neuroscience, and then I would apply to like plastic surgery, there's kind of like a mismatch there, and that could be interpreted as a red flag, and maybe you're getting a PhD to then apply to residency. But I do feel again that you have to portray yourself as a person who brings something with a new perspective, and especially in high academic programs like Dr. Hasserjian mentioned, they tend to review the full application. I know there's a lot of institutions, they use screeners, filters, and they just like remove you if you're older than like 4 years or 3 years. And at least in psychiatry, Mass General, we do review all the applications, and it's really important for us, a personal statement. I don't know if it's because we're psychiatrists, but we really want to get to know the applicants, who they are, what they're thinking, what they want to be, where they see themselves in 5 years. I don't know. So yeah, I think it's just like a very important factor that you need to think about and need to justify what were you doing during that gap. Were you linked to clinical research, or what were you doing? We're just like sitting at home. I don't know.
Absolutely. Yeah. So thank you so much, Dr. Bido-Medina. I would like to go back to the PowerPoint ending with a message of hope and resilience to IMGs. If you can go, Karen, please straight to slide 19 of the presentation. I would like to let you know that FAMER, which is the Foundation for Advancement of International Medical Education and Research, it says that IMGs play a vital role in US healthcare, comprising about 25% of the US physician workforce. And as per the last reports, AAMC, Association of American Medical Colleges, predicts a shortage of about 125,000 primary care physicians, surgeons, and medical specialists during the next decade. This could be attributed to the aging populations. As we can see, this is confirmed, be it the aging population itself as patients or the retiring physicians. So following in the very last slide, we can see that the projected physician shortage by 2034 by specialty area you can go to two slides after, if you could, please. So with the biggest shortage being in primary care specialties in which IMGs occupy an important role in underserved areas. And I would like to add that the US has passed legislation that will actually increase residency positions over the next 5 years, funded through Medicare, the largest increase in the last 25 years. I would like to last advertise the IMG event, the IMG committee, and I would like to thank each of our panelists and their thoughtful suggestions and insight. I would like to let you know and invite the current attendees to join the new IMG committee in Mass General Postdoc Association, whose chair is Yerong Zhu, and is very happy to help explore the ground of opportunities for international medical graduates. Last but not least, I would like to show in the very last slide, which actually represents the very first slide that I had when I first joined med school. You are not studying to pass the exam, you are studying for the day when you are the only thing between the patient and the grave. I would like to thank all the attendees for committing to this noble mission that is rather a mission than a profession. And I am happy to take some of the Q&A if the time allows. So we have already addressed the fact when it comes to the steps and the change after the pass or fail. So someone is asking if you could please talk about any advice for the applicants who have interview invitation from MGH and also the pre and post interview emails to the program. Dr. Hasserjian or Dr. Vyas, if you could answer this.
I can quickly stab at that. It's a hard question and programs are different. I would say in terms of the interview, just very quickly, first of all, pay attention to your body language, make eye contact with the interviewer. That's both if you're one-on-one in a Zoom setting and also in groups. Nod, show that you're listening. I would say, again, listen to what the interviewer is saying, be present and be genuine. I completely agree. I think Dr. Medina mentioned that. I think be very genuine about yourself. And if possibly, be specific. Again, don't just say, oh, I'm enthusiastic about the specialty, but say what you like about things. Be able to say specifics about your experiences related to the specialty and be able to ask specific questions to the specialty that show insight into that and that you're really thinking deeply into the specialty and the program specifics. So that's just a few minutes about my thoughts about that.
Dr. Vyas?
I agree with everything Robert said. I would just say that if I'm looking at the screen right now, which I am right now, this is what I look like. But if I'm looking at my camera, which now I can't see my screen, this is what I look like. So to portray just what Robert's saying, and to act is to show that you're engaged, you actually have to have a conversation with a camera and not the screen, which is kind of a hard thing to do because we're none of us, at least I will say I'll speak for myself. I wasn't born a newscaster. And so that was, that was one of the things that had come a little bit hard. In terms of the communication before and after, I think that certainly after is a popular time for people to write. Many programs will give you some explicit instructions about that. We don't specifically forbid it, but it doesn't help. It doesn't influence us in any one way or the other. I will say, if you had a paper that got published or if there was some change to your application that you thought was important for us to know about, I think that that is a reasonable time to say, hey, listen, I want to update my application and let you know about this paper that got published or this poster that got accepted or this talk that I was invited to. That can oftentimes be useful information that the committee may be interested in hearing about.
Thank you so much, Dr. Vyas. Thank you to all our panelists. I would like to thank all the attendees for joining us today. I know you're on tight time, you might be having your rotation going on, but I hope this panel has served you. By serving your purpose, we have met the objective of this meeting. Thank you so much and have a great afternoon.
Thank you. Thanks so much.
Thank you.
Thank you.
Pleasure.